Thank you, Chairman. General West, let's talk first about the General Leonard Wood Army Community Hospital at Fort Leonard Wood. This was to be replaced originally in FY16. I see it's now deferred again until FY21. It's been 40 years since there's been any substantial reworking or rehabilitation of that facility. Your predecessor, General Hiroho, last year said that it was still the #1 top military construction priority. I know at a Senate hearing just a few days ago, you talked about this hospital and the advances they were making in telemedicine. I guess I'm just hoping for some reassurance that this isn't going to continue to get pushed forward. Not many alternatives for the active duty, the retirees, or the families that are served by this hospital, and 40 years is a long time not to do much to a hospital.
Thank you for that question, Senator. And yes, I understand from General Hiroho's commitment, and it was an honest commitment to placing that in the FY16 as a #1 priority. My understanding is that that was due to budgetary constraints. Basically removed from that. It was reprioritized not by Army Medicine, but other projects that that were deemed to be more, have a higher priority.
Is it still the top medical military construction priority?
For the 1721, yes, it is, Senator. We've put that back in. We have assurances that it is in the cycle. It's a, assuming no other, external requirements to remove that, we are committed to move that forward for our for the FY 1721 cycle. In the interim, though, I want to stress that we were making sure that the current facility is, maintained and still, receiving upgrades. In fact, just recently in FY 09, there was $21.9 million spent on renovating and expanding the primary care clinic and several other initiatives to ensure that the current facility is maintained to provide safe health care, high quality health care to our beneficiaries while we're waiting for the new facility to be constructed.
Well, we're going to continue. I hope you continue to keep an eye on it. It is a facility that serves a lot of people, including lots of retirees and their families, as well as families of those currently serving. We're debating on the Senate floor a bill on opioid and heroin abuse. In every set of figures I see, particularly veterans and veterans that are recently out of the military, have a higher level of musculoskeletal pain, have a higher likelihood to have used opioids and a higher likelihood to still be dependent on opioids. I'd like all three of you, any thoughts you might have on whether we're looking for other ways to manage pain, having any success finding non-opioid alternatives to manage pain, and what are we doing to help those who serve so that whether it's a IED attack or a training accident or just the wear and tear of full-time service, that they're having the pain they're having because of their service to us, and this doesn't need to be a prolonged thing. Hopefully after they leave the military that they continue to really suffer from the pain addiction that they have received, at least the pain medicine. Let's start, General Edgar, with you.
Yes, sir. In the Department of Defense, we have a pain management strategy, and each of our services have established pain management services and clinics in our hospitals. And I know in the Air Force, we are actively pursuing the addition of more integrative medicine capability to the way we practice. And so we have a very active acupuncture training program in progress. And we've trained almost 2,000 clinicians in terms of use of acupuncture, and other integrative medicine tools are being evaluated for implementation. And the interest here is on helping service members find a way to manage pain without necessarily depending on the use of opioids to do so. We know there is a place for opioids and they should be used judiciously, but we know that there are a lot of other tools we can use in pain management in order to give them an effective way to move forward with their lives without the high concern about opioid dependence.
Admiral, you have anything to add to that?
Yes, sir. We also in the Navy and the Marine Corps are very concerned about pain management and have invested heavily in this. We have established comprehensive pain management services at many of our larger facilities to include putting physicians through fellowships specifically for pain management and established telemedicine capabilities for our smaller facilities for consultation for patients with pain. So we've worked on this very hard to provide a safety net of educated providers who can manage pain successfully. In addition, we have ongoing education programs for not only physicians, but our nurses and others in pain management and alternatives that we routinely use. Many of our pain management patients are case managed, and we're blessed with electronic systems that allow us to look at the medications that a patient is on. If it's paid for by the Department of Defense, it shows up in our systems, and we routinely review those as part of case conferences. And then finally, we've invested heavily in alternative medicine. So we have trained over 100 providers in acupuncture and other alternative therapies and put those teams in places where there is high demand. And we are seeing a downward trend in our use of need to use opioids or other pain management medications.
General, I assume your answer's similar, and I'm out of time, but this is an area that obviously the Congress is very attentive to. We made a big increase in the amount of money available to these programs last year, and now giving more direction legislatively to it. And too many of our veterans are impacted, and too many veteran suicides involve opioids and heroin, and we need to stop this. Thank you, Chairman.